Okay, this video is cardiology a joke? And so the most common cause of heart disease, when people say heart disease, what they're really talking about, essentially always unless they otherwise specify, is coronary artery atherosclerosis. That's said to be the most common cause of death in the westernized world. That's why people die. Let's say 26% due to myocardial infarction and similar type death, arrhythmia and whatnot, versus about 25% due to cancer. And I would also say a lot of people essentially are half dead by the time they get older anyways from dementia, even though they don't eventually die till later with a myocardial infarction or a stroke. But anyways, be that as it may. So what's the point? If you look at heart disease, from coronary artery disease, coronary artery atherosclerosis, what causes heart attacks, myocardial infarction? What's the percent of patients cured with pills? It's 0%. They're never cured. They always have to take those pills the rest of their life. That's like cholesterol medicines, your statins. That's also like anticoagulants. You can take anticoagulants for a variable amount of time after surgery. But basically, a lot of times they're on aspirin for the rest of their life. They don't ever get off the pills. All right. What's the cure for, let's say, an elective stent placement? During a myocardial infarction, an acute heart attack, being put on the cardiac cath table and having an artery opened up with a guide wire and a stent, that can save your life. That's great. But I'm talking about the vast majority of patients just have outpatient angina and they go in for a stress test, cardiac cath, and they get a stent. Okay, what's presented them are cured for life? Zero. All that does is it treats the epicardial coronary arteries, the big ones on the outer surface of the heart. It doesn't do anything for the intramyocardial branches. And if you remember the William Roberts paper where he did autopsies on like 2,000 patients who died of myocardial infarctions and coronary artery disease related arrhythmias and whatnot, it was always diffuse. There was no such thing as single vessel coronary arteries. It's always diffuse. And you can only stent the proximal segments of the coronaries where they're big enough, in the ballpark of 3 to 4.5 millimeters. You can't put a stent in the way distal, even epicardial coronaries. You're not going to be able to get in there, okay? And you can't do anything about the branches that go into the myocardium, the intramyocardial branches, okay? And what's the cure rate for coronary artery bypass surgery? CABG, okay? Coronary artery bypass graft, open heart surgery, a lot of people call it. It's zero. It's the same. You're stuck with the same problem. You can only bypass the big branches. You can't do anything about the intramyocardial branches, okay? So, and it's always going to be diffuse. You can't put a bypass everywhere. So that's what I'm saying is these don't change the situation and what's going on in all these little branches all over the place. What's the cure rate for Esselstyn's diet? Low-fat vegan diet with no oil. It's near 100%, okay? 99.9% of people go for these treatments up here, pills, stents, and open heart surgery, that have 0% chance of a cure. And less than 1% goes low-fat, low-sodium vegan, where they have near 100% chance of cure. There might be some familial hyperlipidemia where they still need to take some medicines or something, but the vast majority of patients can be cured with this diet. So, only an absolute moron, idiot, stupid person would choose a very expensive treatment that never works versus a very cheap treatment that almost always works, okay? And if you look at cardiologists, they're smarter than your average doctor. Most of those guys are pretty fit. They're, more careful, not necessarily low-fat vegans, even though that's the trend they're moving in, but they're getting their exercise. They're usually a pretty fit group of guys. The kind of attitude in conventional medicine is that the patients are just hopeless, stupid idiots, and there's no point in trying to teach them. They're not going to listen. They're not going to change their behavior, and who's got the time anyways? And you don't get paid for that, and it's not the standard of care. And if you give them that advice without giving them the pills or the procedure, and then they subsequently have a coronary event, you could get sued, so forget it, Take your pills. Good luck. Go talk to the dietitian. The dietitian's going to recommend Mediterranean diet. So, like I'm saying, it's kind of a joke. You always get the treatment that never works. Okay, and then what's the cure rate for hypertension? Now, hypertension is not necessarily treated by cardiologists. They can treat it, but of course, it's usually treated by internal medicine doctors and other primary care doctors and whatnot. And again, it's something similar. You go on pills, the cure rate is 0%. They never get cured. They just keep on eating the same bad food and messing up their arteries over time, getting more arterial and capillary level fibrosis, collagen accumulation. Okay, you go low-fat, low-sodium, whole food vegan with no oil, about 90% of them. The sooner that the patient starts eating this way, the better chance they have of reversing the problem and not having to take any medications or go for any procedures. But the more chronically they have it, the more calcified their arteries are, the less they've lost their, ascending thoracic aorta, Wind-Kessel effect and whatnot. But But what I'm trying to say is there's this attitude amongst Americans that, oh, go to the University Medical Center. That's where the really great doctors are. And even the best are places like the Mayo Clinic and the Ivy League. Yeah, right. It's a big joke. It's like something out of the 1700s, doing the same therapeutic phlebotomy on everybody. Give me a break. You've got something that actually works, but no one talks about it, and doctors don't even know it. And that's why I have my parable of the zookeeper, because it's kind of ridiculous that a zookeeper knows what to feed their animal, but a medical doctor doesn't know what to feed a human. That's no joke. That's real, and that's the most common cause of death in the Western world, is that ignorance.